In this video, we will be addressing dissociative identity disorder. The history of dissociative identity disorder, originally known as multiple personality disorder. Dissociative identity disorder was first seen in 1791 in a German woman who spoke perfect French and behaved like a French aristocrat, although the woman denied knowledge of the French identity. In the 1970s, the diagnosis for dissociative identity disorder rose after the book Sybil was released in 1973. It was during that decade that the most reported cases of dissociative identity disorder in all of history occurred, since 1816. The case of Shirley Ardell Mason was when dissociative identity disorder became more prevalent, yet it turned out that this case was untrue, as recordings of the psychotherapist Camilla B. Wilbur was suggesting these ideas to the very impressionable woman. The prevalence of dissociative identity disorder. According to the most recent studies, the prevalence of dissociative identity disorder is at a 12-month period is 1.5% of the American adult population. Some studies found that dissociative identity disorder is 9 times more common in the female population. Others claim they are equal or more prevalent in the males, approximately 0.2%. The reasoning behind the confusion of what gender the dissociation disorder shows prevalence in is because males are less likely to report their mental illness. The symptoms of dissociative identity disorder. It is a response to a traumatic event in childhood, such as abuse. A person may feel like one or more voices are trying to take control in their head. They switch between 2 or more alters. They tend to experience amnesia between alters, and people with dissociative identity disorder experience gaps in memory. Dissociative identity disorder shows many, if not all, base symptoms of an dissociative disorder. Treatment for dissociative identity disorder. Treatment for dissociative identity disorder is psychotherapy, which decreases symptom frequency and improves coping strategies. Dissociative identity disorder should not be diagnosed unless dissociation is observed or a change from one personality to another occurs in the room with a psychologist. Treatment for this disorder has to find the root and find a better coping mechanism for this person instead of creating defenders for the base person. Controversies behind dissociative identity disorder. Many clinical and licensed psychologists do not believe that dissociative identity disorder is in fact a real disorder, because the first case of the disorder turned out to be fictitious, made up by a psychologist and her client. In effect, it is seen by some as a sociocognitive or iatrogenic in origin. It is also very rarely seen by psychologists. Celebrities with dissociative identity disorder. Adam Duritz, a singer-songwriter. Marilyn Monroe, an actress and singer. Trudy Chase, an author. Herschel Walker, a football player. Nina Simone, a singer and pianist. Movies that feature and are about dissociative identity disorder. Frankie and Alice, released in 2010. Fight Club, released in 1999. Primal Fear, released in 1996. Psycho, released in 1998. Secret Window, released in 2004. And Split, released in 2016. The sources for this video were found at NAMI.org, ncbi.nim.nih.gov, and did-research.org. Thank you for watching this video.